A bit about my credentials. I started my journey 3 years back. I decided to do USMLE when I was doing my internship. So I have been preparing since then. My step one is pass. I was in the pass fail group. My step two was 240 and my step three is 244. I graduated in 2022 from SV Medical College in Odisha here in India. And since then, I've been preparing for USMLE and doing everything. I am born and brought up in a very small village of Jharkhand. And I am the first generation medical doctor from my village. So today I'm going to answer all your questions and doubts that I have gone through in this journey. Feel free to ask me any questions in the chat box, or you can just turn on your mic and ask if that is comfortable for you.
All right. Thank you so much, Dr. Swati. I think we can get started with the questions that were asked in the Google form. And meanwhile, if you guys have any doubts, feel free to keep on, accumulating your questions in the chat, and we'll, not me, but Dr. Swati will get to them. Okay. So we have a question. How to overcome an attempt in step one?
This is a very common question that I've been asked. Like, people are in the dilemma: if I have a step one attempt, is it a red flag? So I approach this question in a very systematic manner. There are actually, I think there are 4 pillars that are considered during the whole USMLE journey, from the day you start thinking about USMLE to the day you get matched. So there are 4 pillars that the recruiters, the program directors look into an application. The first one is the examination. Since people from all over the world are applying, there needs to be a standardized exam that attests to the ability of the applicant, because the medical school in Colombia is different, the medical school in India is different, and so on and so forth. But the first one is the examination, and under the examination comes step 1, step 2, step 3, and OET, these things. The second pillar is the professional activities that we do, which includes our research and the clinical experiences that we gain. The third pillar is, how are you as a person? How are you outside of medicine? And that is decided by your personal statement, and it's decided by the volunteering activities that you do. And what is your backstory, and why do you want this specialty in this program, so on and so forth. And the fourth most important is, how easily will you blend in a new system which is very different from the system that you originally come from. And that is decided by the USC, the type of USCs you do, and the type of LORs you get out of those USCs. So these are the 4 pillars. And now you can see that step examination is one of the pillars. So even if you have red flag, even if you have an attempt in the step, there are 3 other pillars that you can work on to strengthen your application and to prove your candidacy to the program directors and the committee that yes, I am capable of doing it. Because from all the experiences that I have gained, examination is one part, but the way you are as a person, and the more easily you can blend in the US healthcare system, is obviously prioritized more above anything else. So even if step 1, if you have an attempt in step 1, you have step 2 and step 3 to prove. If it's step 2, you have step 3 to prove. And if it's step 3, I have heard that it's important for you to pass in step 3 if you do it prior to the match and not in the intern year. So that is it about that question.
All right. Thank you so much for that detailed answer. Next question is, how to revise previous things or usual things if one is not an Anki person?
So Anki is like a flashcard, and we have to understand the idea and the concept of Anki cards. So the science behind Anki cards is spaced repetition. And as I know, I am from India, we are not that open to using flashcards. Like, not a lot of people uses flashcards for spaced repetitions. The only time that I used flashcard was in anatomy to revise the nerves and the blood supply for each and every muscle in our body. So that being said, if you are like open to spaced repetitions, like revising the same content that you read 2 days before, you can do it in multiple ways. You just have to identify what kind of a learner are you. In one of my interviews, I was asked this question, like, what type of a learner are you? Are you a visual learner? Are you a audio learner? Or are you a stereotypic, the one who touches kinesthetics learner? So the most important thing is you have to identify. Some people write and remember, some people read and remember, some people listen and remember. So identify the method, like whichever suits you, and then go for the spaced repetition. So for me, I was someone who never makes notes on an iPad. Like, I think I don't have that much time to make note and then go on and revise. I know it's advised to have your own set of notes, but what I used to do is whenever I solved a UWorld block, I had in my notebook the UWorld notebook that is given with the UWorld package. I used to have different subjects like OBGYN, pediatrics, and so on and so forth. And under every subject, I used to have chapters. Like in OBGYN, I had preeclampsia, I have gestational diabetes, and different chapters within it. And whenever I used to solve these questions, I used to put in the things that I did not know before or I did wrong into those. And I used to revise at the end of like a week. For example, I gave a week for OBGYN. So on Saturday or Sunday, I used to revise all the things that I went through, I did wrong, or I came across as new. So this was the kind of spaced repetition I used to do. And this is how you can also do, you can have your strategy. There is no correct way to do Anki. But yes, some of the concepts in the Anki are really new. And I think it's not given in UWorld, or even if it's given, you might miss it given the length of the questions that we get in UWorld. So even if you don't do spaced repetitions, just go through the Anki cards once to see, okay, these are the things that I don't know before, and just annotate it in your UWorld application or in your first aid book. That would be all.
All right. Should Pakistani graduates continue with the USMLE journey given the new travel ban?
Actually, I cannot comment on Pakistani graduates because I'm not from Pakistan. I am from India, and the immigration rules are dynamics. So it is not okay for me to comment on those rules. And the third thing is that the visa process for this year match applicants, after those travel bans or the documents that have been circulating in Reddit, the visa process is not complete yet. So people who have matched this cycle from Pakistan would be more better suited to answer this question, like how are they feeling or what are the challenges that they are encountering, if so it is, if at all it is true.
Next question is, please share what to do to get into psych residency, and is it that competitive for IMGs?
For starters, the only thing that I know about psychiatry residency is that the people in psychiatry have a very robust committee. They are really into supporting medical students and graduates from all over the world. They have a lot of activities and opportunities. So you can always look out for those opportunities on Twitter or Instagram. They have their own account, the Psychiatry Association in the US, or even the Psychiatry Association of Indian Physicians in the US. So you can always reach out to them, join their committee, and help them in their organization and activities. This is point one. And as far as the question is concerned, I think for every specialty, the answer would be same. And as far as I know, psychiatry is also IMG friendly. Like if you really show dedication for psychiatry, you can really get into psychiatry residency. It is not that hard, but that being said, the dedication should be evident from your profile. So what I think for every specialty is you need to have hard work, you need to have luck, you need to have strategy, and you need to have mentorship. Hard work comprises of the examinations that you do, USCs that you do, and the volunteering activities that you do, the overall CV that you have. So you have to work on that. Luck is a factor no one can control. It depends on you and solely you. So I cannot actually comment on that. In strategy, we have networking, we have connection, and we have the right selection of program. So this year, what I have seen is that geographical preference and program signaling have played a major role in the interview invites. Many of the people were of the opinion that if I have a geographical preference, I may get more interviews. Some of the bizarre things that I came across was that the numbers that you put, the US number in your ERAS application, the area code will also determine the interviews from where you'll get. For example, I had the area codes from Massachusetts. So a lot of things just fly around in the community during the match season, but you don't have to believe in everything that you do. Whatever is your geographical preference, you should stick with that. And the selection of programs and the signaling should be on point. You should not signal programs that are highly competitive, like Cleveland Clinic and then Mayo Clinic, if you don't have enough connections or networking around those programs. That being said, a number of good programs receive, for example, they received 300 applications, but the signaling was in such a manner that they received 3,000 signals as well. So you can see the number of applications and the number of signalings are equal. So the signaling, your signal was wasted in that particular program. So you have to signal wisely. And the most important part that I felt was mentorship. And the fact about mentorship is that the stage at which you get mentorship. For me, if I had got a mentorship at the time when I was planning to do USMLE, things would have been different for me. I would have networked better, or I would have done better in my steps, and I would have had a more strong CV than I thought what I originally had. So that is really important. And if you require like any mentorship, 1:1 mentorship, you can always reach out to me. I will put my email ID here and you can always reach out to me. That would be for that question.
All right. Thank you so much. Okay, so we have a question that's very specific to you. How to be part of Project IMG for networking and make connections?
So let me tell you a backstory about how Project IMG started and what were the things that we used to do at that time. So I was just scrolling through my Instagram one day and I saw Dr. Sebastian's story. He was then in OBGYN. He was a first year resident. He just joined freshly and he was sharing about making a book about USMLE because he had a good deck of Anki cards, which was color coded. So he wanted to make it in a book. So I joined the WhatsApp group and I remember we had like 5-6 people back then and I was one of them. And we started working on the book. And then since he was from OBGYN, he also proposed that let's make a book for the general public to explain the things that only a medical student or someone from healthcare knows about, like eclampsia and diabetes. So we started working simultaneously on that. And then one day we were in a meeting and I proposed like, why not have a platform where the IMGs can showcase their talent? And from then showing about talents, we started having posts about the USMLE journey. We started having things about like vaccinations and USCs and everything and so on and so forth. And then one day, Dr. Sebastian also planned a small meet and greet in New York, which was known as the Project IMG event. And thankfully, a lot of IMGs showed up for that event. And since then, it has been a tradition that we have Project IMG event, the main event that happens in the US every year at different locations. And then we have small IMG events in respective countries with the ambassadors of different states and different medical colleges. So this was the story behind Project IMG and how I joined it back then. I also started as a volunteer and then I became the social media manager, which is now our moderator, Japleen. And how to join? So the people of Project IMG are very sweet. They are very collegial. And the thing that we value a lot is reliability. Since we are not paid for this role and this is a volunteering opportunity, the only thing that we can rely on is trust. Trust that you will respect our time and trust that you will deliver on time. So we are very flexible in the things that we offer or things that you can help us with. There are two things, short-term commitments and long-term commitments. And a lot of places like you can help us in content creation, you can be a posting volunteer, you can reply to the DMs, you can handle our Twitter account, LinkedIn account. So there are a lot of stuff that you can help us with. You can help us conduct webinars or you can help us volunteer for the research activities. It's about the intent that you have. And if you ever want to join Project IMG, just shoot a DM on the Instagram handle or on the LinkedIn or Twitter. Or if you can find anyone who is from Project IMG, you can also inquire them and you will be guided to the right person for that particular job. That is about Project IMG. You just have to reach out, you just have to have the intent, and rest of things we'll take care. We'll train you, we'll tell you how things work around, and then you will be a master in no time.
Yes, absolutely. And yes, as Dr. Swati said, if you guys want to join our social media team, you can just shoot us a DM, and I'll be guiding you through the things that we do, and we'll be happy to welcome you in our Project IMG family. So I guess we are done with the questions asked on the Google form. Guys, you can type your questions in the chat. We'll give it a few minutes. Think. Since we don't have a lot of participants today, so I think that will work in our favor. You can ask your personalized questions from Dr. Swati, and she'll be happy to answer them. I'll just give everybody some time.
And after you're writing your questions, I would love to tell you that for the networking part in Project IMG, we have Project IMG events throughout the year in different countries, even in the US. And we have a lot of program directors, even ECFMG and NBME personnel that come to that particular event. So that is a great opportunity for having the networking opportunity. And that being said, I have been a part arranging all the Project IMG events, but then I have never attended any Project IMG event. I really wanted to, but the time it was organized, either I was moving back from US to India or I was in India preparing for any steps.
Yeah, that happens. But the good part is that we were always connected through social media. And
yes.
We've been working
it's live streamed. We have like a crazy group of people working behind the scenes throughout day and night. The time difference between India and the US, we used to work like around 1 a.m. getting pictures and then uploading it in the stories instantly so that you guys know what is going on in that event. So yes, a lot of hard work, sweat goes into arranging those events.
Guys, please type your questions in the chat. Meanwhile, I think I have a question I'd like to ask you. What was your guiding principle in this entire USMLE journey? Some piece of advice you would like to pass on that helped you be consistent in this journey, especially during the tough days, because we all know it's a very tedious and daunting kind of journey. So sometimes
I have never seen a journey so difficult with so many paths and the idea that the option to choose which path to take depends on you, and the path which you take affects your career in the long run. So one thing that fueled me throughout this journey was the sight or the feeling that I would get if I match into a residency program. That is what helped me go through it. And I always knew that there are a lot of people in my community that I can look up to. I had Project IMG with me. I met with a lot of people. I made new friends. And trust me when I say this, when I started this journey, I don't think anyone from my medical school had gone for USMLE. The last person that went for USMLE was in 1992 from my medical school, as far as I remember. And at that time, there was no USMLE. You had to personally mail all the applications via mail to all the programs while being in the US. So you can think, like, after a gap of around 20 years, someone was starting there and I had no one around me to mentor me. And at that time, Project IMG was my source of inspiration. Like, I had a lot of people who I talked to. I talked to Dr. Sebastian about the process and everything. So it's more about the community that you have, that you look up to and see, okay, I have someone who knows what is step 1, what is step 2, what is step 3. And not because most of the people around us are more focused on the Indian post-graduation, like NEET PG and stuff like that. And it's very difficult to identify with them or connect with them on a level that we USMLE aspirants connect to each other. So that was my guiding principle. Community and the farsightedness.
Wow, that's amazing. I think you always had it in you to think out of the box. So that's what is really inspiring. Okay, we do have questions on the chat. USMLE Pathway asks, what do you think helped you get ranked in Lahey Hospital?
For me in Lahey is first was my interpersonal skills. Because if you look at my application, I was also interested in medpeds, so it had a mix of both medicine and pediatrics. But the first thing that it helped me was my interpersonal skills. The way I talk to them, the way I convince them why I am a good candidate for their residency program was the first thing that I think at the top of my head helped me rank. The second thing which I believe was my clinical experience. I had 1 year junior resident position at AIMS Gorakhpur. So it really helped me a lot to understand how an academic institution works on that particular level. So this was the thing that was brought up in the interviews as well. And the third thing was the aspirations that I had in regards to fellowship or medical education or the research project that I was interested into. These three things I think at the top of my head were the top three reasons why I got ranked at Lahey. Yes.
We have next question from Juan Nicholas. In terms of step one, how do you guys control the nerves the day of the exam, and if there's something you would change from your routine that day? I'm giving step one in 2 months and I'm struggling.
This is like a really tough question because when I was doing my step one, it was my first exam and I had never given a 7 hour long exam anywhere in my life. So I was really like stressed about it. But then I thought like it's 7 hours, but we have particular blocks. We have 40 question block per block. And I had a clear clear plan in my mind that I'm gonna do 5 blocks at a stretch, 4 to 5 blocks, and then I'm gonna take a break apart from the restroom breaks. And I also did not drink coffee on in the morning of my exam. I did carry coffee for my examination, but I did not drink coffee on the day of exam because it makes me a little bit more jittery and nervous before I start my exam. And one thing that I would love to change from my routine was if you have 2 months, I would advise you to start sitting for like 5 hours at a stretch. Even if you are solving questions or revising your notes, doesn't matter. At least try to sit 5 hours to 6 hours at a stretch while you are studying. It will help you get into that mindset. And whatever is the timing of your examination, you just try to wake up at that time. And from there, you start sitting for like 5 to 6 hours. That will be the best thing that you can do from now.
Okay. The next question is from Janish. Apart from scores, what are the deciding factors that led to an interview invite?
As I already mentioned in one of my questions, apart from the steps, the things that help us getting interview invites is the overall CV that we have, which includes the volunteering activities that you do, the clinical experiences that you have, the research activities that you are interested in. Now, with research, I have to be really careful because everyone has different interest in research. For example, someone does it just for the sake of matching. That's completely all right. With the competitiveness of all these specialities, it is okay to think in that terms, like even if I'm not interested in research, I want to do it for the sake of matching. That is okay. The one thing that program directors are looking into is the intent that you have for research, because in the US, we always practice evidence based medicine, and evidence based medicine is based on the research that we do. So even if you show the intent through a case presentation, a poster presentation, or attending any meeting and showcasing your research in that particular platform, it is okay. You don't need hardcore meta-analysis or systematic reviews to be termed as researcher, and you can tick the box for that particular portion in your ERA CV. That being said, there are specialties like dermatology, orthopedics, general surgery that are very research intensive. So for these kind of things, people generally do 2 years postdoc research position or research assistant position. The another thing that is, who are you as a person outside of your medical profession? That is also a very important thing. And the most important thing apart from scores is the interpersonal skills. I cannot emphasize more on these because every day I get a question from one of my mentees that so and so person had really low step scores, but yet he matched. But then this person has a step 2 score of 259 and had 6 interviews but did not match. So The only thing that I can see from these two scenarios is the interpersonal skills. You really need to practice your interview questions. You need to get familiar with the type of questions they ask, and you really need to have a presence of mind to answering every question that turns in your favors, even if it's not in the beginning.
Indiscriminately. And also indiscriminate use of higher level antibiotics should be avoided.
Guys, please mute yourselves. I think. All right. Okay, next question from Kosi. Can you further explain about your junior residency in AIMS? How did you secure that role?
So I applied for a junior resident non-academic position in AIMS Delhi as well as in AIMS Gorakhpur. In AIMS Delhi, we are required to pass the examination of INI set, but then without those also, you can get entry into the AIMS Delhi. It's just that people with INI set scores, even if they have passed or not, will be given preference. This is about the Central Institute AIMS Delhi. The rest of all AIMS in India gives out specific advertisement. You have to go on their website and keep checking. They keep on rolling out the junior residency positions, for example, a 3-month period, a 6-month period, and which can be extended up to 1 year. So whichever AIMS you are interested to join apart from AIMS Delhi, whose application starts just after the INI set concludes. So the application goes out twice a year. I think its first is in November and the second one is in June, if I'm not wrong. And for rest other AIMS, you have to go on their website specifically to see. Most of them have walk-in interviews. Some of them have like virtual online interviews as well.
All right. I think we have a few more questions on the chat. Okay, we'll try to answer them. Swati, please let us know if you're running short of time. We can shift these questions to your takeover if you want. And if you want to take them right now,
yeah, I can
do that.
All right. 2 questions, yes.
All right. Seenat asks, I'm looking for mentorship applying for psych residency. So I think that question would be more suitable to somebody who's matched into psych. But yeah, please go on.
So definitely, as you said, this will be more like suitable for someone that matched into psychiatric residency. But then we have a lot of Instagram takeovers in Project IMG, and I can like tell you 100% that some of the Instagram takeover who have recently matched will be from psychiatry. So you can always reach out to them. At the end, they always give their emails or the Instagram handles, and you can always reach out. There is no harm in reaching out. The one thing that I have learned from this whole journey is it is a no until you ask. So you can email, you can talk to, you can message anyone that you feel like can add value to your residency journey. So I would advise you to message everyone. Even if they don't reply, it does not matter. It depends on them, but at least you reached out. I sent across 1,000 emails and messages throughout my journey, and I can tell you that only 10% of the people replied. But those 10% of the people have played a major role in the success of my journey. So it's a no until you ask. That would be my advice.
Very true. We have another question from Kolsi. How were your USCE? Is it possible to do hands-on after graduation? How can I? And the second part of the question is, how can I perform well during USCE?
My idea of USC was to have not only have the LORs, that is the most important thing, but to have a grasp of how the US healthcare system works. I did not know if I will match into a university program or a community program. So I did one observership in pediatrics because, as I told, I was interested in med-based as well. The second one I did in a hospital inpatient ICU setting. The third USC that I did was in a clinic and inpatient, a combined one. And the fourth one was totally outpatient clinic. So I wanted to have a hang of how everything functions, and I did not want to mix up those experiences. So I spaced it out into 3 different rotations, which was all from IM. So this was my USC. And the second question is like, is it possible to do hands-on after graduation? Definitely. So what I advise my mentee is that having few rotations reserved just for observership, in which you go to a university program, you meet a lot of people and you make connections, and the LORs that you get holds value if it's personalized. And second set of rotations should be like through an agency or just cold emailing the professors that really give out hands-on opportunities, because a lot of Indian physicians and physicians outside of the United States who have immigrated into the United States do give hands-on opportunities to a lot of students. So reaching out to them, having hands-on experiences will help you understand how things work around in the US. So hands-on rotations are really important if you really want to know how the EMR works and how patient scheduling works, how billing and insurance works. So yes, it is definitely possible. A lot of people do hands-on rotations, and you can find a list of programs from the Project IMG highlight or the Instagram that we have. We do have a list. Dr. Sebastian has also posted a beautiful list on Twitter, if I'm not wrong. And how can you perform well? So you have to have a plan before going on for a rotation. Show up on day one. Before going into the USC, just email them and ask if there is anything that I should be ready with before starting the rotation. What are the timings for the doctor? Is there and if you know any previous student who has rotated with them, you should ask him what he likes, what he doesn't like, what are the ethics that he works around with. Always arrive on time, be polite, always show your curiosity. Everyone knows that you cannot have the knowledge of everything. I remember in one of my rotations, I used to write very detailed notes for an outpatient clinic. That was not required. So my preceptor told me that you have to write very succinct notes, and you can always finish those notes later when you are done with the patient for the day. And so these are the small advices that you get throughout your rotations that will help you build your path to residency. Like when you start your residency, you will remember all these things. So USC is actually a very important part. And when I am telling you that we have to balance a lot of things, exams, volunteering activities, personal commitments during USC, but I would suggest you to be as free as possible during USC so that you get a grasp of the things that you're doing. And it's very easy to perform really good. Just be yourself, be professional, don't be inconsiderate of other rotating interns or externs there, and you will be good to go.
Well tried. Our next question is, can you give some advice in formulating a personal statement, and what, according to you, are to be must included?
The personal statement is something that is a very important piece of information about yourself. It beautifully blends in the person you are, the person you were, and the person you will be. So a personal statement is just like a mirror which represents your past, your present, and your future. So it should when I read your personal statement, I should have an idea of these three things that I really talked about: your past, present, and future. So for personal statement, what I did was I started, the deadline was on September 25th for this year. So I started formulating my personal statement 2 months back. I did not write anything. I did not make the first draft. I just started writing points or incidences from my background that really affected me. For me, it was having no resources while I was studying. It was having no electricity while I was in my school, the place where I am right now. So these were the small things. The time when my grandmother got sick and I could not meet her before she passed away because I was treating someone else in my medical college during my internship. So these are the very striking incidents that happened in my life that shaped the way I am as a doctor, or that shaped the way I am as a person. So I started jotting down those points. And by the end of 1 month, I had a solid 14, 15 pages worth of things that I would love to include in my PS. Now I started sorting out through them, which will like selecting the most specific ones or the most important ones that I thought would best reflect who I am. And then I made the first draft. And for the first draft, there is no word limit. You can make 6-page, 7-page personal statement, doesn't matter. Then you start sorting it through, then you go to multiple revisions. And then when you are satisfied, okay, this is what I think it is, then you send it out for review. And when I tell you this, the first draft that I wrote, that I sent out to everyone, was totally opposite from what I sent out to the programs. So it keeps on revising. There is no harm in revising your personal statement. And what, according to you, must be included? According to me, what must be included is the drive, is the reason why I chose medicine. It can be anything. It can be related to your interaction with another person. It can be related to any incident in your life or anything. It's just that you have to show the intent why you chose medicine. That is the most important part.
Our second last question from AMC. Did you gold signal the program you matched into?
Yes, I did gold signal Lahey Hospital Medical Center.
Last question is from Amrita. Is there one thing you think you could have done better or changed in your residency journey?
Yes. For me, I think there are two things that I could have done better. Three things rather that I could have done better. The first one is starting early. I started towards the end of my internship because of some personal reasons and the specialty that I was interested in to go for residency. Had I decided it before in my second or third year, if someone was there to guide me, I would have taken it up much before, because doing electives is far more better than doing externships after I graduated. A lot of committees that I could have been a part of without paying a single membership fee was out of my reach. A lot of programs that could have hosted me over without any fee started charging like $3,000, $5,000. So yes, I would have started early. The second thing was I would have reached out to mentors had I know how to do these things, like how to email, how to reach out to mentors, how to get a mentor for myself. So mentorship was also very important for me. I received the mentorship very late in my stage when I started doing USCs and making connections. And the third thing was I was going through a really difficult personal time. So I should have postponed my step two, but then I thought like, let's get done with step two, because I also decided way back that I wanted to do step three as well. So I scored really average, that was 240. But then with the increasing demand for specialty in internal medicine, people have been scoring above 250. So that is the new normal. So these are the three things that I think I would have done better.
Okay, we have the next question from iPhone 15. Are we supposed to draft program specific personal statements?
That would be better if you draft program specific personal statements. But as IMGs, I know we apply to around 250 programs. So I don't know if it is possible for you to have personalized PS for 250 programs. I would say like pick your top 10, 15 programs that you have a decent chance at matching at. So let us do one thing. If you choose 15 programs, the 5 programs should be the top ones, like you have a dream of matching into. The next 5 programs is suitable for your specific profile. That should be the next 5 programs. And the last 5 programs should be your safety net that you would personalize your personal statement. If everything goes wrong, you get no interviews, at least those programs who take candidates who have slightly below profile than what you have currently will be a better safety net. So choose top 15 programs and make the personalized personal statement for that. That would be much easier than going through like all 250 programs and just adding a paragraph about that program's features, copying it from their own website and putting it at the end of your PS. That would be bizarre. So it's better to choose and then go on about the personal statement.
Next question is from Dr. Meenu. How did you do the interview preparations? Do you recommend taking help from agencies?
I in no way endorse any agencies for interview preparation. You have a lot of people around you who reach out. You have residents, you have your own peers, you have your mentors, and there are a lot of people out there on social media or in your personal network that can help you with interviews. I would recommend start practicing common questions that you get around. We also have post about these on the Project IMG social media handle. Start practicing it, start having your own answers, start talking to yourself, then go seek help from your friends, and always do 1 or 2 mock interviews with a stranger who is in the same journey, because the way you talk to a stranger is really different from the way you talk to your friend, and they can give you real advice. And how did I prepare? I know the common questions. I noted down how I want to answer those questions. But trust me when I say this, the interview, the way you answered in your first interview will be very different from the way you answered in your last interview. So it's okay. It's okay to mess up. In the first interview, you will get a hang of things like how would you have answered the questions differently. So you don't need agencies to help you with mock interviews until and unless you are really not confident about how you interview, or you are really not confident about your interpersonal skills. That needs a little bit of grooming, but then it can happen. You can seek help with any resident or any mentors that you look up to.
The next question is from Tamara. Did you pay for mentorship?
No, I did not pay for mentorship, but yes, some of the specific mentorships that I seeked were from individuals, and they charged a small fee, not at all near to what agencies charged, but they did charge a small fee so that I respect their time, they respect my time, and just to make sure that I was serious in seeking mentorship. And that is what exactly I also do. I charge a small fee so that since I am in residency, I will be really busy at every time. So I have to have something that I can look up to, that I have promised you. I know my work ethics, that's sure, but I'm also human. I'll also get tired. So I don't want your time to be wasted just because I am tired. So for that commitment and for the respect of our time and the seriousness of the situation, charging a small fee, I think, is okay until and unless it is not way above what other people charge.
We have next question from Kolsi. Did you apply? Just a second. Did you apply to both PEDS and internal medicine programs? And part 2 of the question is it a red flag for program if we apply to both internal medicine and PEDS programs simultaneously?
So for my situation was a bit different because I applied to MedPeds. That was my top choice, followed by internal medicine and PEDS. I did not apply to a lot of PEDS program. I only applied to around 13 pediatric programs because I had like some sort of connection, or I rotated there, or I had a strong feeling that my profile would get selected here. I mainly applied to MedPeds and internal medicine programs. MedPeds, I went all in. All of the profile or my profile screamed of MedPeds, and I got a decent amount of interviews for that as well, and for internal medicine as well. I got interviews, and no, it is not considered a red flag as long as you explain the intent and you are true to yourself. It's very normal to have those, because when I was asked whether I applied for both, I said that I'm interested in MedPeds. This specialty is what I aspire to be someday, but then I have equal intent for both medicine and pediatrics. So that is what I said, because if I am ready to go for MedPeds, I'm ready to go for both simultaneously.
What do you think Lahey stresses on most to get in for their internal medicine residency?
Like every program, they stress on the candidacy of the applicant. You have to be really dedicated and motivated. You also have to be someone who is a team player, who takes into account everyone, respects. You have to be someone who has a good profile, good overall profile, and have a good amount of USC or your LOR, speak a lot about yourself. And I think Lahey is a program that prefers a feeling, a sense of belongingness, a sense of family that I felt during the interviews. Everyone was so collegial and they made me feel at home, at ease, and I was really very comfortable. When I say I did prepare for Lahey, but since it was my last interview, I was really losing my patience, but then I prepared for it. And the time I joined the interview, I felt at ease. They were really easy. They asked really conversative questions. We had a very good conversation, the chat with the program director as well. He was wonderful, the way he talked about the program and the new changes that are coming in to Lahey, because it has now it has affiliations with UMass Chan, Beth Israel Deaconess, and then it has also affiliations with Tufts University. So there are three huge universities that are part of Lahey system of health.
Next question is from Mohammed Arif. Please share the list of USCE along with PD emails. Will be highly thankful. I have a list, but that does not contain USCE related to neurological surgery. I find it challenging that less USCE opportunities in neurological surgery for IMGs, and if available, these are far more costly than other programs.
I cannot comment on surgical specialties, especially neurosurgery. I have actually no idea about this. But if I find something, you can always shoot up me. I have my email right here. Just shoot up me, and if I ever get across any list of that sort, I will be happy to send it to you. Yeah.
Another question from AMC. Did you rotate at Lahey?
No, I did not. I did get asked this question a lot, but I did not rotate at Lahey.
Dr. Nino asks, okay, we have quite a few questions coming in now. Can you share where you did your USCE? Did you do outpatient or inpatient rotations?
So I did my first USC at Massachusetts General Hospital in Boston. The second USC that I did was at Jackson Park in Chicago. The third USC that I did was at Corewell Health in Dearborn. The fourth USC that I did was in a clinic which was affiliated to a physician who worked at Houston Methodist Hospital. So these were my four rotations. The first one was in pediatrics, and the rest three of them was in internal medicine.
Okay, Indu asks, what's the email? She's actually shared it in the chat. It's swati.rani1410@gmail.com. It's in the chat. You'll have to scroll down. And the question from Kosi, if you don't mind, can you please elaborate your perspective on applying to both PEDS and internal medicine program?
So as I explained, it was a different scenario with me because I applied to combine med-peds as well. If you are just solely applying for internal medicine and PEDS as a safety net, or PEDS as your main specialty and internal medicine as a safety net, you have to apply strategically. You have to first decide which is your priority. If it's internal medicine, your CV should be more gravitated towards internal medicine. And if it's pediatrics, it should be gravitated more towards pediatrics. Having a safety net is okay in this competitive specialty, means increased competitiveness, but then you have to be really strategic about how you apply, which programs you think internal medicine would be better suited for and which will be PEDS. And I would advise against applying to internal medicine and pediatrics for the same program. Say for Cleveland Clinic, if you apply for internal medicine, don't apply for pediatrics. And if you apply for pediatrics, don't apply for internal medicine, because it is a very small world and program directors talk more frequently than we think that they do. But when it comes to med-peds, it's okay because they understand that the applicant is interested in med-peds, but from the statistics, only 16 IMGs matched into med-peds this year, and that too, those IMGs were a green card holder or already had a visa. So it's really, really competitive for med-peds. So they understand that even if you are not selected in med-peds, you can always go for pediatrics or internal medicine from university, but don't do it for two different specialties, definitely.
Amrita asks, how did you prepare for an interview for each program?
So after I got the interview dates, I used to give 1 week to each program. I used to search about their website from Reddit, from the resident profiles from their Instagram handles, and I used to jot down all the points that I come across, simultaneously preparing questions for everything that I did not understand or I wanted more information about. And then I used to practice all the common questions that I have written for my interview specifically. And then I used to prepare for socials just the day before the socials, because all my socials were around 3 a.m. to 4 a.m. Indian time. So I used to have a list of questions way before that, the day before that. So this is how I prepared for specific interviews.
We have the next question from Salome. What advice do you give to IMGs who don't match but are still bent on pursuing residency in USA? Any other pathway or taking up research programs, etc.?
So the first thing that I would tell you is that don't lose hope. If you are really hell bent that you have to do a US residency, you will definitely get it. Many people, my best friend also that I met through this journey, also matched in her second cycle. So it's the intent that matters. You must have missed out on 1 or 2 points, or the luck was not in your favor that you did not match, but don't lose hope. It is really very doable. You just have to have a right plan and right approach as to what I will be doing different from what I did in the previous cycle, and just make a plan out of it. Like, I would be doing this number of USCs again, I would indulge in a research position. And if you take my advice, if you have a clinical position, a good clinical position in the same specialty in your home country, that would be much valued than having a research position in the US which does not pay you. I have seen people who had clinical experience that has been valued more than a research position, until and unless it is a specialty that is very heavy on research, or second, it is a research position which is at a great institution and in the specialty of the choice that you are applying to match for. And if you have any specific questions or you need any specific plan or advice, you can always reach out to me on my email and we can have a chat separately about it. I might be a little late in replying. I might take 2-3 days, but I will definitely reply.
The next question is from Dr. Meenu. If you don't mind, can you please share how you found the rotations at the hospitals you mentioned? Directly applied through the hospital website or emailing the doctors?
I did a mix of emailing the doctors, and I also applied by emailing the hospital, the program coordinators, and I also applied through an agency where I find that the cost justified the rotations. So I had a mix of everything.
We don't have any more questions in the chat. I think we can give it a minute.
Okay. And if you have any questions left over, you can always shoot me a DM on my Instagram handle, or you can email me. And I will also be coming for an Instagram takeover at Project IMG as well. You can have your questions answered then as well. And if you have anything that you think it's really personal and you cannot ask here, you can always email me.
Yeah, I'll give it a minute. Then I think we can end the meeting. Okay, we have a question. How do we get personal mentorship from you through email?
Just shoot me an email like what you need help with and what are your stats, like where are you in your journey and what you're looking for, and then we can take up from there. I can have a call with you and figure out a plan together how to get you land your dream residency.
All right. Thank you so much. Thank you so much, Dr. Swati, for taking out the time to do this on a Sunday morning. It's very early in Sunday for you, I know. And we loved your very clear and strategy-oriented advices. And I'm sure it'll help a lot of people who will watch this recording later on. I can confidently say that your approach, the way you think and the way you manage this entire journey, it has definitely given me a different perspective, so to say. So, okay, do we have any other questions on the chat? Email or Instagram handle? Okay, you already typed that. All right, thank you so much, guys, for joining us today. Please watch out for our future webinars on our Instagram page. We'll be having one webinar every month with residents or incoming residents so that you can ask your personalized questions from them. And yes, if anybody would like to join our social media team as volunteer, or if you want to join our webinar team, just shoot us an email. Somebody from the team will contact you, add you to the group, and we can have a one-to-one conversation on which page in Instagram. Okay, I think they're asking your Instagram handle for Project IMG. I'm not sure.
I cannot type the underscore here. Whenever I type it, it makes it italicized. So it's underscore Swati underscore Sharma 75. I'm typing it in words. That would be much easier. Underscore Swati. Just replace the underscore with the symbol, and then that is my profile.
Guys, if you want to reach, okay, Amrita typed it out for you. If you want to reach out to her profile after this webinar is done, I'll share a story. I can share a story with your username, right? I hope that's fine for you.
And it's fine.
So yeah, you guys can reach out to her.
Yeah. So it's underscore Swati underscore Sharma. There is an underscore after Swati as well. Before, sorry. You can share my Instagram handle on the story if anyone wants to reach out.
Yeah, I think I'll do that. Okay. I think I'm going to end the meeting. Good day, everybody. Have a nice day. I hope you do well in your USMLE journeys.
You will definitely do well.
Of course. Of course. All right. Take care of yourselves. Be well, eat well, stay healthy, and all the best to Dr. Swati as you start your residency soon. And we'll be back with our next series next month with somebody else. So see you guys next time. Bye-bye.
Bye-bye. All the best, everyone.
Thank you. Thank you so much.